Hi, I'm Vincent Lin with HFMA, and I'm here with Solventum's Global Vice President of Revenue Cycle Solutions, Jason Burke. Thanks for joining us today.
Thank you.
So we've been seeing the Solventum name show up more and more, stating a mission of enabling better, smarter, safer healthcare to improve lives. Can you tell us who or what Solventum is and how you're helping to address major challenges in healthcare?
Yeah, so Solventum is a new public company that was founded this year. It was a spinoff from the 3M healthcare companies. So it's made up of 4 different businesses that comprise healthcare IT, which is what we do in our division. And then we also have a dental group. We have a materials science group, which is all of our supplies, infection prevention solutions. And then we have a water purification group. And so the mission of our company is to focus on making both patients and healthcare workers more efficient at what they do to better the lives of patients and the employees in healthcare providers and payers, and to enable them to be able to do their jobs at a much higher level and to be more efficient at what they're doing.
That's great. So during our annual event, Solventum issued an interesting press release around denials management. It's a hot topic with a lot of people trying to solve the problem. What's Solventum's approach?
Yeah, so we're taking a very unique approach. We feel like the denials problem has been around for a very, very long time, and it's getting worse. And so our approach is to provide meaningful information during the workflow processes while the patients are being treated, while the CDI specialists are doing their documentation, and while coders are doing their work, to be able to avoid the denial. So we are focused heavily on being able to predict whether a denial is going to happen and providing them with the right information so they understand why we believe that patient will be denied, and then what actions to take and do it in the workflows versus waiting until the denial happens and reacting after the fact. And so we've been developing this technology with our existing technology. It's got a very robust set of clinical and financial and operational content information, but also leveraging large language models and artificial intelligence to add those capabilities to be able to automate this in a real-time basis.
Oh, that's really interesting. So what does a proactive, preventative approach to denials look like?
So it looks like, a physician, for example, may not understand that record's going to be denied for medical necessity, for example. And so we process years worth of the client's historical data, their denials data. The AI model is looking at that historical data to be able to uncover all of the causes for those denials. And then we have created actionability into the content that we've created in the workflows. And so a physician, for example, we don't want to overburden them. Their jobs are all about treating patients. They should be. But we need to make sure that they understand that they may not get paid because, for example, their sepsis documentation may not be specific enough based on the care that they're delivering. And so as we insert that information into their normal everyday workflow, the goal is that they don't have to change what they're doing in their job. They just have to address the things that are going to create problems. And so we're doing that both in the physician level, like I said, all the way through the revenue cycle process with those users, because a denial could change, right? The predictive denial and the reason for denial could change when you go from physician documentation to a case management, for example, to a coding. And so there's different aspects that need to be addressed at those times to make sure that the denial is avoided.
That makes sense. So how can technology help leverage existing workflows? How important is having facility-specific denial insights to driving measurable change around denials?
I mean, it's critical. We couldn't have done this, 5, 6, 7 years ago without the new generative AI models that have been created that are, obviously taking over the world by storm. But the other part of this is you have to marry that technology with clinical intelligence, financial intelligence that creates that actionability piece. And so that's where I would say that applying artificial intelligence and large language models to healthcare information, you can't just use that technology alone. You have to marry it with additional knowledge and expertise that's related to healthcare specific problems in order to create the right outcome and the right content for them to take action.
Yeah, well, that's really interesting. I think that's all the time we have today. Thanks so much for being here and having this conversation with us.
Thank you.
Thank you.